If you have a low oxygen level, the first thing that you need to do if you have a neuromuscular condition is to get a positive pressure breath or positive pressure breathing or volume. That's all basically the same thing, rather than first putting on oxygen. If with positive pressure breathing the oxygen level does not come up, sometimes supplemental oxygen is needed. But it is very important that first positive pressure breathing is initiated. The positive pressure breathing, which can either be done through BiPAP or ventilator, can also be supplemented with assistance for clearing out the lungs by using a cough assist or breath stacking maneuvers through an ambu bag that has been modified. You can obtain a pulse oximeter either online, it's about $25, or at your local drugstore. It is important to practice this when a person is not sick, so that you know what their normal heart rate is and also what their normal pulse oximeter reading is. It's important to know where each piece of information is on the device and how to obtain a good reading that you can understand. You can obtain a cough assist machine with a prescription from your breathing specialist. The breathing specialist will help you learn how to use this machine and will also be responsible for setting the settings, if it is used in an automatic fashion, the length of the inhale, exhale, and pause, as well as the degree of positive and negative pressure that is recommended for you. An ambu bag can be purchased online. However, it is very important that you take the ambu bag into your doctor to have them help you modify it to use it for breath stacking maneuvers. Once it has been modified, it can no longer be used for resuscitation, and it can only be used to actually help a person increase the volume in their lungs or chest to generate a more efficacious cough and to also open up their airways. To obtain a BiPAP or a ventilator, you will need a prescription from your physician, who will perform several tests to determine whether in fact you need that piece of equipment. If a person with a neuromuscular condition gets sick and their oxygen level falls, the first important thing to do is to give them volume or positive pressure. The sequence in which you do this is you could start by trying to augment their cough by using a cough assist, or if they are already familiar with breath stacking maneuvers using the ambu bag, doing breath stacking maneuvers and either doing an assisted cough or attempting a spontaneous cough. If that person is already on BiPAP or a ventilator, then putting them on their BiPAP or their ventilator. At any point in that intervention, you need to recheck their oxygen level to see if it is now trending upwards. If their oxygen level is trending upwards, which may take somewhere between 30 minutes to an hour with interventions, then you can continue to do the interventions and alternate between assisting cough and giving them positive pressure breathing through their BiPAP and or ventilator. If the oxygen level continues to fall, the person looks worse, or you feel that you're not achieving any change in their status, then it is important to call the doctor or to go into the emergency department. With all pieces of equipment, I recommend that you practice using it before the person gets sick. Sometimes it's good when you first get equipment to actually practice it on a daily basis, so that both you, if you're the caregiver assisting, and the person who is going to be receiving the intervention feels very comfortable with the intervention. Checking the pulse ox can be done for the whole family. So everybody can check their pulse ox if you have a child with a neuromuscular condition to see on a daily basis how their oxygen level is and what their heart rate is like until you get comfortable that you know what their baseline is. It's important to learn how to use the cough assist as well before a person actually is sick. And to learn how to breast stack does require some practice. It's important for the person who is breast stacking to be able to learn how to close their glottis, and for the caregiver, if they're doing it themselves, how to time their inhalation with giving them some additional volume. And then, of course, getting used to BiPAP or a ventilator does take time. So it is very important to practice all of these pieces of equipment before the person actually gets sick. I recommend that everybody gets a flu shot this year, both the person who has the neuromuscular condition as well as the caregivers. The flu shot does not prevent you from getting the flu, but it prevents you from getting as sick from the flu, hopefully by exposing your body to the flu virus ahead of time and allowing you to build up immunity and your defense system. It is important for people with a neuromuscular condition to not get the nasal mist, which is a live virus, which can potentially also lead to an infection, but to get the injection, which is a dead virus and therefore cannot cause sickness. It is important for the caregivers of the patient with the neuromuscular condition to also get the injectable form rather than the nasal form, because the nasal form potentially, if they themselves got sick, they could then pass on that illness to an affected family member. If you notice that a person has a low oxygen level who has a neuromuscular condition, and again, the person may not have very impressive symptoms. I'd like to share with you the story of what happened 2 weeks ago in my own family. My daughter, who has a neuromuscular condition, we rolled her to the dinner table and she didn't feel like eating. She had had 2 days of a runny nose and she just didn't really look like herself. She had a low energy level and it wasn't obvious. She didn't really have a cough. And I said to my husband, this is kind of strange that she doesn't feel like eating. Let's check her oxygen level. And her oxygen level was 86%. We immediately left the dinner table and began several interventions. The first intervention that we did was to try and help her have a cough. So we used the cough assist using both positive pressure breaths and positive followed by negative pressure breaths to try and help her cough. Then we put her on her BiPAP machine because she is already on a BiPAP machine for an hour. And then at the end of the hour, we rechecked and we redid her cough assist, 3 sets of 5 positive pressure breaths. At several points throughout that hour and a half, we rechecked her oxygen level. And we noticed even after the first time that we used the cough assist machine that her oxygen level had gone up to 90%, and then it went up to 94%, and then it was up to 97%. So as long as when you notice that a person who has a low oxygen level with a neuromuscular condition, as long as they are not acting out of it and you feel that you can attempt interventions in your home, if the interventions are showing a trend in the right direction and the oxygen level comes up in a fairly short time period, then you can continue to do those interventions. However, if the oxygen level is very low or the oxygen level is going in the wrong direction, or you feel that you cannot perform these interventions at home, then it is important to go into the hospital. It is possible to also pay attention to the heart rate on the pulse oximeter. It's important for people to realize that the heart rate in a child is often over 100 as a normal reading, and in adults, a normal heart rate is under 100. The heart rate can go up because of fever, dehydration, pain, or also because the oxygen level is low. I find it most useful just to start focusing on the oxygen level. And remember, by focusing on the oxygen level, the first intervention that you are going to do is not to reach for oxygen, but to reach for volume or positive pressure through either a BiPAP or a ventilator, or through helping the person generate a cough through positive breathe pressure breaths or positive negative breaths through a cough assist, and or through breath stacking using an ambu bag. If the pulse ox reading is low, less than 94%, there's no one right way of doing the intervention. The most important thing to realize is that when you do an intervention, you need to check that your intervention is working. So when you use the pulse ox in the beginning and you see that the oxygen level is low, it is important after you do the intervention to recheck the oxygen level and make sure you're heading in the right direction and you're getting closer to 100%. Okay? You don't need to leave the pulse oximeter on the person's finger. You can put it on their finger, do the intervention, take it off, do the intervention, and then put the pulse ox back on their finger again. The sequence in which you do the intervention doesn't really matter. It all depends on the comfort level, both of the person, how they look, what they're comfortable with, and also how comfortable the caregiver is with performing the interventions. Remember, there are two different types of interventions. One, if the person is already on BiPAP or ventilator, to put them back on their BiPAP or a ventilator, even if it's during the day. And the second is to help them have a cough, and that is either done using the cough assist or the ambu bag. In the scenario that I described for you when my daughter became ill, we started first with cough assist. As soon as we were done with our repetitions of cough assist, we rechecked her oxygen level, saw that it was starting to go up. Then we put her on her BiPAP machine, and every 15 to 20 minutes we rechecked her oxygen level and saw that it continued to go up. And then at the end of the hour we did another cough assist, and at that point her oxygen level was greater than 97%. It is important to note that you can do the cough assist on the hour, every hour when a person is sick. But the cough assist always needs to end with a positive pressure breath, and the cough assist can make a person a little bit tired because, especially if you're using the negative pressure, it can be a little exhausting for the person who has the neuromuscular condition. So it is important to think about how sick the person is to gauge the frequency with which you should be doing the cough assist. If you currently are not using ventilatory support, which means either a BiPAP or a ventilator, it is still important for you to own this one piece of equipment called a pulse oximeter. People with neuromuscular conditions can have a very slow and gradual decline over time in their breathing ability. That decline may be so gradual that it may not be noticeable to that person. And when a person gets sick, they may just feel less energy. And as I explained in the example of my daughter, you may actually not have a fever and you may not really have a cough, but you may just feel kind of blah. It is important during those moments to be able to measure your oxygen level to see if your oxygen level has actually fallen. And it's important to know before you get sick what your normal oxygen level is, which can be measured on several different days when you're not sick, so that you have a baseline.